this is Dr. Mukhtar Yerima. Welcome back to my channel. Today we're going to talk about what you should do if you think you have depression, or what you should advise a family member or a friend to do if they think they have depression. In previous videos, we've talked about the features of depression, what causes depression, why depression is commoner in women. Today, we're going to talk to you about what you ought to do. The first thing you should do if you think you have depression is to try to see a doctor. Try to see a psychiatrist. If, however, a psychiatrist is not within reach, try to see a doctor. Seeing a doctor is going to help you achieve a number of things. One of them is that the doctor is going to go through all the symptoms you have with a view essentially to confirming your suspicion that you have depression. The doctor is going to go through all the symptoms, is going to ask whether you have been having sustained undue feelings of sadness, reduced energy, decreased activity, ideas of guilt and unworthiness, loss of interest and pleasure, hopelessness, reduced appetite and sleep. All the symptoms of depression is going to go through them with you and find out the duration of the symptoms and how much the symptoms are affecting your life. The next thing your doctor is going to try to do for you is to try to assess if there were any precipitating factors. Were there any things going on in your life that may have been responsible for you developing the symptoms? Just as we talked in previous videos, there are factors that we call negative life events. So in most patients that develop depression, there are significant negative life events that have happened in their lives several months before the onset of the depression. This is important so that something can be done on those precipitating negative life events. The next thing that your doctor is going to try to do is to assess the severity of your depression if it's there. Depression can be mild, moderate, or severe depending upon the number of symptoms, depending upon the intensity of the symptoms, and even depending upon how much the depression is impairing your life and how you're able to function generally in your day-to-day activities. Another thing that your doctor is going to try to do is to assess if there are other medical conditions. It is not uncommon for patients with depression to have associated medical conditions. There are a number of medical conditions that tend to coexist with depression, and one of them is diabetes mellitus, one of them is having liver disease, another one is having cerebrovascular disease, or people who have had stroke. Depending upon the type of the stroke or the part of the brain that is affected by the stroke, they tend to have some certain psychological problems, including the depression. So in essence, your doctor is going to try to assess other medical conditions that you may have in addition to the depression, which might just be coexisting with the depression or might even be responsible for causing you to have the depression. In addition, there are times when you are also on medications. Medications also, in some cases, tend to precipitate depression. Not all medications, but there are those medications that are actually known to precipitate depression in some individuals. So assessing your medical conditions and assessing the medications you are probably on is going to give you the opportunity of being evaluated holistically with a view to providing better solutions and probably giving you a better intervention. So when your doctor has assessed all those things, the next thing he's going to try to do is to try to discuss with you treatment options. That is, if the doctor thinks that you are right, that you have depression, your doctor is going to talk to you about the treatment options, the different types of treatments. And there are actually several types of treatment options which are mainly categorized into biological treatments, which essentially means mainly the use of medications, or psychological treatments, which usually include what we call talking therapy or psychotherapy. Predominantly, what is readily available is, of course, the use of medications. However, there are times when some patients would prefer that they do therapy, or when they prefer that they take medication. So, and that's why your doctor is going to discuss all those options for you. The medications are many and they are called antidepressants. He's going to tell you the different names, the different types, the different classes. He's going to tell you their effects, how they do those effects in your body, what they bring about, and how they are able to bring about an improvement in your mood, and the duration that you're going to be on those medications for, and he's going to also try to talk to you about side effects. For instance, one class of the antidepressants called tricyclic antidepressants, for instance, amitriptyline or imipramine, tend to have side effects that make people sleep. But in depression, since some patients do not have sleep, in the beginning, the sleep is usually a required side effect of this medication. But after some time, some patients tend to realize that the sleep is getting too much and they will want to do something about it. He's going to tell you what you should expect from medications generally. He's also going to tell you what you should expect from other forms of treatment, psychological treatments. He's going to talk to you about cognitive behavioral therapy. He's going to talk to you about problem solving counseling. He's going to talk to you about supportive psychotherapy. And he's going to talk to you about what we call behavioral activation. So there are several treatment options, whether you're talking about physical treatments or psychological treatments of depression. Also, your doctor is going to help you to clarify some certain doubts or some certain myths. There are a number of myths surrounding diagnosis of some psychological problems and their treatment. Sometimes some patients think that if they take antidepressants, they're going to become dependent on them and that they do not therefore want to take those medications, and or that in the future they cannot become happy if they are not on the medications and whatever. So all those things are things that your doctor is going to be able to clarify for you. There is actually no evidence to suggest that taking antidepressants cause you to become dependent on them. No evidence whatsoever. So relax, and if your doctor tells you that he thinks you should take antidepressants, take them. They're not going to have any serious life-threatening side effects, and they are not also going to make you to become dependent. Neither are they going to turn you into a zombie, or they're not going to turn you into any unwanted creature. The second advice we're going to give you if you think you have depression is to try to talk to a supportive family member or a very supportive friend. Feel free to talk about depression. Perhaps you're not the only one who has gone through depression in the past. If you talk about it freely with a family member or a close friend, they're probably even going to help you to take you to the hospital. Because remember, if you have depression and the intensity of the depressive symptoms is high, you may not even want to do anything. You've lost interest in life, maybe. So it is talking to a family friend or a family member that is going to give you that boost, that courage, that support to be able to face even going to the hospital, to be able to even face yourself and to face the conditions squarely. So please feel free to talk about it to a friend who is very supportive about it. The third thing you should do if you have depression is to continue to engage in activities, especially or including physical activity. Remember that one of the things that depression would want you to do is to stop engaging in any activities. Depression would want you to fall back and to stop doing all the things you've been doing. But do not stop. There are a lot of evidence to suggest that if you continue engaging in activities that you would ordinarily not want to do because of depression, you tend to have a better outcome. You tend to even overcome the depressive symptoms. You tend to oppose it. The depression wants you to lie down all through the day, but you shouldn't do that. You try to engage in things that you do not even have pleasure doing. You should nonetheless do them. The next thing you should try to do, of course, is to try to continue to engage in physical exercise. Physical activity has been found to have a lot of benefits on the mental health and the physical health of individuals. On the mental health front, if you continue to exercise, there is a direct impact of exercise on the brain, which is that during exercise, a lot of things are elaborated in the brain, which are called endorphins, that tend to make you feel happy, tend to make you feel good. It gives you a kind of rush. And secondarily, if you continue to exercise, there is increased elaboration of a chemical in the brain called brain-derived neurotrophic factor. That brain-derived neurotrophic factor, in the long run, is believed to improve your brain cells and also improve your depressive symptoms. So engaging in physical exercise, and in addition to the normal physical fitness that you get from being physically active, you should engage in physical exercise. So by and large, these are the things that I'm going to encourage you to do if you think you have depression. Number one, you should try to immediately see a doctor, preferably a psychiatrist. If not, see a doctor. The second thing you should do is to try to talk to a friend. The third thing is you should continue to engage in physical activity. Thank you for watching. See you next time.